A sunny afternoon in the neighborhood, it's a sunny afternoon, and a man named Daniel is out enjoying a bike ride. Feeling adventurous, he starts riding faster than usual, weaving through the streets with exhilaration. But in his excitement, he doesn't see a trash can ahead on the sidewalk. Before he can react, Daniel slams headfirst into the trash can, flipping over his handlebars and crashing to the ground. Nearby, a group of bystanders witness the accident and rush over to check on him. They notice that he seems disoriented, complaining of severe head pain, and he mentions a numb feeling in his arm and legs. Step 1. The call for help. Recognizing the seriousness of the crash, one bystander immediately calls 911. The call rings through to the Emergency Communications Center, where a trained 911 dispatcher answers. This dispatcher is the first crucial link in the EMS system. 911, what's your emergency? The dispatcher asks, remaining calm and focused. The bystander explains the situation, providing details about Daniel's condition and location. The dispatcher listens carefully, noting Daniel's head pain and numbness, signs that suggest a potential spinal injury. Step 2. Life-saving pre-arrival instructions. While the bystander is on the line, the 911 dispatcher provides essential pre-arrival instructions. Knowing that moving Daniel could worsen his injuries, the dispatcher advises the bystanders to keep him still and not to move his head or neck. She instructs them to reassure Daniel, letting him know that help is on the way, and to keep him as calm and comfortable as possible. Meanwhile, a second dispatcher at the communications center coordinates with nearby emergency services, sending a response team that includes police, fire, and an ambulance. This team-based response is a standard part of EMS for any situation involving trauma or potential spinal injuries. Step 3. The arrival of emergency services. Within minutes, police officers, firefighters, and EMTs arrive on the scene. Each team has a specific role in ensuring Daniel's safety and care. Police officers secure the area, directing any onlookers away to give EMS personnel the space they need. The firefighters assist with patient assessment and help prepare equipment for safe transport. The EMTs from the ambulance crew take the lead on assessing Daniel's injuries. They kneel beside him, asking about his pain and symptoms to determine the extent of his injuries. Daniel mentions feeling numbness in his arms and legs, along with a throbbing headache, raising concern for a possible spinal injury. Step 4. Patient assessment and stabilization. Following EMS protocols, the EMTs conduct a thorough assessment. They carefully expose the area around Daniel's neck and back to check for signs of injury without moving him. They assess his vital signs, checking his breathing, pulse, and blood pressure. They're cautious to avoid any unnecessary movement that could worsen a potential spinal injury. Deciding on a full spinal immobilization, the EMTs place a cervical collar around Daniel's neck to stabilize his spine. Working with the firefighters, they carefully roll him onto a backboard, securing him in place with straps to keep his body and neck still during transport. Step 5. Transport to the hospital. With Daniel stabilized on the backboard, the ambulance crew carefully lifts him onto a stretcher and loads him into the ambulance. During the drive to the hospital, the EMTs monitor his vital signs closely, ensuring he remains stable and updating the hospital on his condition. This information helps the trauma team at the hospital prepare for Daniel's arrival. Step 6. Hospital evaluation and treatment. When the ambulance arrives at the hospital, the trauma team is ready. Daniel is swiftly transferred from the ambulance stretcher to a hospital bed, and the team begins their assessment. They perform X-rays and an MRI to evaluate any potential fractures or damage to his spinal cord. Thankfully, the scans reveal no permanent spinal cord damage, although he has sustained some bruising and minor fractures. With a clear diagnosis, the doctors initiate a treatment plan that includes rest, pain management, and a carefully monitored rehabilitation program to address his injuries and prevent any complications. Over the next several weeks, Daniel follows his rehab plan closely, working with physical therapists to restore his strength and mobility, returning to normal life. After weeks of rehabilitation, Daniel is able to resume his normal activities. He reflects on the series of events that led to his recovery, the bystanders who called for help, the dispatcher who guided them, the EMS team that immobilized him, and the trauma team at the hospital who provided his care. Each step of the EMS system played a vital role, like gears in a well-oiled machine. From the initial call to the hospital discharge, everyone involved worked together seamlessly, with one goal in mind: ensuring that Daniel could return to the quality of life he enjoyed before his accident. In this scenario, the EMS system demonstrates how every component must work efficiently and in sync to provide the best possible outcome for patients. By working together, EMS teams, hospital staff, and the community create a strong, interconnected network that makes survival and recovery possible, even in emergencies that start with something as simple as a bike ride.